the story of saying, let's say, environmental collapse and climate change are major threats about which we need to do something, when it's said once, it's a new story. The second time, it's an old story. The third time, it said it's not a story at all. Climate change, I think, is the acute illness. This is the chronic stressor that we've just described to the human analogy of the planet. We've been adding a lot of greenhouse gases. This is the rate from last year of what we're currently burning. And that's been going up year on year on year on year. That means atmospheric CO2 is rising. We bust the 400 parts per million in May. And there's no signs of that slowing at all. We've achieved that, the highest CO2 concentration for more than 3 million years. We've done that in 150 years. The total energy gain, which I think is a better term in many ways than climate change, is over 0.6 watts of radiative forcing per square meter, 20 times the energy we're using. And that's between 4 and 5 Hiroshima bombs per second of added energy to the Earth's climate system. 146 million nuclear bombs a year. That's pushing temperatures up, and even the climate deniers' work, the Berkeley study, funded by the Koch brothers, actually came out with the worst of those recordings. So why does that matter to human health? And why did The Lancet say this in its last Commission report? It matters because bacterial growth rates change with temperature, because we get oceanic and river algal blooms, because we get changes in vector-borne diseases, such as dengue, schistosomiasis, and malaria. But more, we get these increased in extreme weather events, which statistically we now know are related to climate change, to global warming, as it was once phrased. Here was the extreme heat events of 2003 and 2010, up to 75,000 deaths in Europe in 2003, and this major event, particularly affecting Russia in 2010. Now that matters because it has very big impacts. Huge areas affected, the Russian fires generating a state of emergency, and consequently famine, not just from fires, but from crop failure. This has contributed to food prices going up, and if you talk to those at McKinsey's, or indeed many in the financial markets, they don't see this shock in grain prices going away. This is the start of an inexorable rise. And if we look at what happened in 2010 as a consequence of the grain price rise, as we spoke of before, prices rose from around $150 a metric ton to somewhere around $350. And that was absorbed by the supermarkets in this country because you need to go and buy bread, but you also buy toilet cleaner, CDs, and red wine. If your staple was bread, this made a very big difference to whether you could feed your families, and is now considered to be a trigger to the Arab Spring events of that year. Nick Stern said that would be compounded by poverty. He now thinks this was an underestimate of the impacts of what was coming from climate change. And that's why this matters to human health. It's to do with famine, pestilence, poverty, migration, and conflict. And those are the key drivers, in my view, of poor health internationally. And we know the war side has been gaining ground. We know the Pentagon were putting out open reports in 2003. The result could be a significant drop in the human carrying capacity of the Earth's environment. That's a very nice way of saying lots and lots of people dying. Now that's with about a 0.78 degree temperature rise. There's not a hope in hell, whatever you're told, of us staying at 2 degrees. That's long gone in my view, and it's in the view of many others indeed. I don't know what the IPCC report's going to be saying this month, but I'm guessing it's going to say we're stuck with upwards of 4 degrees. And the Philosophical Transactions paper puts that in a very human context. A 4-degree rise is incompatible with an organized global community, beyond adaptation, devastating to the majority of ecosystems, and probably a stage post to much higher temperatures thereafter. And I'd remind you, this is happening in your generation and your children's, if you have children. This, ladies and gentlemen, is why we need radical transformation. But I've had a long-standing interest in environment and climate and its impacts on health and relationships to it. So one of the questions we've been discussing at the conference today is how we make change happen. And it seems to me that we need to understand the barriers to that. And it further seems to me that this is a triangular structure that involves three major sectors. There are others. There are politicians, there are business people, or businesses, and there's the hoi polloi, us. And the problem is that the general public are confused sometimes about the truth and what they need to do. They feel that they don't have many choices. If they're very rich, they say, well, life couldn't get much better for me than this. If they're very poor, the last thing on their agenda are these other issues. So they don't pressurize politicians. And being fair to politicians, politicians can't act readily unless they feel that they have a democratic mandate to do it. You could also say that that's running scared, that we need leaders. But either way, they can't take on these big issues if they feel it would be a massive vote loser. You've then got businesses who say, well, unless the public demand a particular change in the way we do business or product, or a government mandates that it should be so or changes the regulatory structure, then we can't act. And you therefore have a sort of interlocked paresis. Worse than that, that tessellates out internationally. So even if a business grouping was to say, right, well, we're going to really change the way we do business here in Britain, or politicians were to say, we mandate that you must do this, they'll say, well, that's all very well, but the rest of the world won't do that, and will just be outcompeted on price.
So everybody waits for everybody else.
Everyone, and in fact, it's many ways we've always harangued people, say, well, they're all guilty for not acting. But actually, when you look at it that way, they're all paralysed from acting. Even with the best will in the world, it's hard for people to make the moves forward. So the question, I suppose, is how we break that. When I first started having to present science to media, research science, for instance, I was told by a very wise journalist called Andrew Gardner, who sadly long since passed away, say that I had to understand the difference between stories and news, and that media weren't after news. They weren't after information, they were after stories. And the story of saying, let's say, environmental collapse and climate change are major threats about which we need to do something, when it's said once, it's a new story. The second time, it's an old story. And the third time, it's said it's not a story at all. It's only a story if someone says, it turns out that all of this is rubbish. Then it's a story. So that for years we've been told that we aren't allowed to tell people that things like environmental change and climate change are bad. The idea has been that we've told it repeatedly, that if you tell people things like this, they will stop listening and run away. What you've got to do is sell them a dream. I think that's nonsense for a number of reasons, say not least of which, if you come to me as a middle-class, good earner, and someone says to me, but your life could be so much better, I would say, better than what? I have a lovely wife, 2 lovely children, a nice house, a minimal mortgage, a great job. If I wanted to, I could fly to the Bahamas once a year for a holiday. How can this new green thing be better than what I've got? Because it's pretty damn good at the moment. And if we go to people who haven't got those opportunities, they'll say, thanks very much, but actually I'd like to have a job, and I'd like my 5 kids to have a proper education, and I don't give a monkeys about this other stuff. Let's get the priorities in a good order. So selling a dream of the great green world, I don't think works. And furthermore, when I'm speaking to someone with with lung cancer or whatever it might be, what you don't say is, I'll tell you what, smoking cigarettes is great, and cutting down could be even better because you'd have this great new life ahead of you. You have to say, if you continue to smoke after this, your chance of dying horribly is very high. But if you don't say that, the message people get is, well, it can't be really that serious. And we've all done that for far too long. By framing the great green opportunities, people think, well, what I'm hearing then is it's not that dangerous to me. So I think we need to be not brutal, but honest. Only then can people say, now I understand it and I have a choice. I understand the imperative to act. Now, what is it that I should do? And I don't know what the answer is, and of course that partly is why we're not making progress. It's because if people like us who sort of get it we've got two issues, haven't we? One is to convince other people that there's the problem. But the second thing is, when we do that, the question is, okay, that's great. So now what is it that I do? What's the vision for where we go? And we've spent an hour and a half in a plenary session this morning where the experts we had 3 on the platform talking today, and the audience, none of us know what that yet is.
What are the things you have done, Hugh?
I'll tell you what we've done, but then I'll also tell you why it's inadequate. So we stopped flying on holidays. So we holiday in Great Britain or Ireland. We try to make those low impact, so we stay on a little island that doesn't have piped water, gas or electricity and so forth. We try not to heat our house very much, which my kids seem to tolerate remarkably well. I think children do better than grown-ups, and to wear more clothing rather than turning heating on. And we've tried to go for the usual lowest energy things we can. We're doing some rebuilding work next year to try to improve the energy efficiency of the house in a balanced way where we're not polluting more than we're saving. So there are those sorts of issues. We've meat reduced. I don't buy red meat anymore. If I'm served it, I will eat it. But if I have a choice, I will choose something else. So there are those sorts of things. But, and here's the big but, if I look at my own carbon footprint, I might have gone down from around 12 metric tons to maybe, I haven't calculated this year, but I would have thought somewhere between maybe 7.5 and 8 metric tons.
You or your family?
Well,
your
me
household?
as an individual. In Britain, mostly, we're somewhere around 12.5 metric tons per person, and I guess I'm down by about a third of that, I would guess, to where I was. But that is still so completely and woefully inadequate, and I think and there is more I could do to bring it down a bit more, and it would still be inadequate. And I think that's the issue. I'm still looking for the thing where I can really do something that makes a big difference.
What is going to be the big thing that's going to happen that is actually going to lead to the real radical transformation we're talking about? Because I don't really think it's necessarily going to come from opinion and, social media and stuff. I see it somehow as an external, perhaps very physical set of events, or massive political events like we saw, for instance, with the World Wars, where we completely re-engineered our economy very quickly.
I mean, I'm not from this world, I'm from an engineering firm, and this feels a bit like a design meeting. And if we're wanting messages going forward, I really expect to see lots of back-of-the-envelope sketches, and the debate really being in those sorts of terms where we talk about numbers, we talk about the implication of those numbers, to get some sort of message that you're taking forward. And I really haven't seen what the message is yet from this group that knows more about it than any other.
You're asking for solutions. I'm looking for solutions. I'm looking for a key message. And I think often the communication between politics and the civil society is actually lacking. So that's what I think the issue here is about, in terms of, do you want to be part of the change? Yeah. So creating enabling structures to be part of the change and part of the solution.
One of the issues we've spoken about today was how transformational change can happen, and radical transformational change. And one of the key messages we learned today, or was reinforced, was the issue of breaking down sectors and producing roadmaps. In government, you then got energy, who's responsible, and you've got one group, might be DEC, trying to reduce emissions, and then you've got trade and industry, whose job will say, well, that's not my job. My job is to maximise productivity and trade from Great Britain. End of. And none of them are wrong. They're all doing their brief to the best of their ability. Somehow we need to find some way of saying, couldn't we just find a way where everyone wins from this? And someone might have to give a little bit here and there. But can we find that sweet spot, which Bettina from WHO was talking about today, where economics, health, social factors and so forth all benefit? And that's something I've taken away from today. We're all waiting for someone else to come up with that little blueprint of the sweet spot nexus. Maybe we should be doing that.